Hello and welcome. The UBDI has been training future registered dietitian nutritionists for excellence, innovation, and leadership in dietetics since 1999. We are so pleased that you are interested in joining our legacy of high-performing RDNs serving across the state of New York and across the world. My name is Nicole Clem and I am the Program Director. Thank you so much for viewing this informational webinar. If you have any questions, I'm available by email, phone, video chat, and a stop-in at Kimball on South Campus. The program prepares graduates to become entry-level registered dietitian nutritionists who improve the health of populations, communities, and individuals. Our program philosophy centers on these 4 points of distinction: educational excellence. High quality, high level clinical nutrition graduate coursework gives you a strong science and evidence base to practice from. Interdisciplinary collaboration. From simulations with athletic training to large forums with hundreds of other graduate health profession students and on-site exposure to interprofessional practice, this program is preparing you to work on the healthcare team of the future. Use of the research process. Experiencing the research process at an R1 level school means real-world implications are being studied here. Through your rotations and an optional thesis track, interns understand how projects are developed, what good research looks like, and how to understand the data. This helps our graduates become registered dietitians who can debunk pseudoscience claims with quality studies and data. Critical thinking skills. Our clinical director and preceptors guide you through a series of rotations in practice areas such as clinical nutrition, community wellness, and food service management, where you'll be challenged to work through patient and population care scenarios. As a result, you'll be better able to make well-informed judgments, be able to explain your reasoning, and be able to solve unknown problems in the field and in the future. Within the university, the MSDI is housed within the School of Public Health and Health Professions. Our school has over 1,000 students, 74 full-time faculty, and an alumni network of over 6,000. Our faculty researchers receive over $10 million in funding. The school itself is split across 5 departments: biostatistics, community health and health behavior, epidemiology and environmental health, rehab science, and then us, exercise and nutrition science. The program is one of 2 schools in New York State offering a graduate degree plus internship training. The Exercise and Nutrition Science Department has many faculty, but these are our primary professors for the program. And research varies across our department, but there really is something for everyone. Completed and ongoing study topics include caffeine use among adolescents, exercise and nutrition interactions, factors that influence ingestive behavior, the development of obesity in humans, the neural controls of energy balance, food reward and motivated behavior, and functional foods and nutraceuticals. The University of Buffalo is a Level 1 research university, and so our affiliations with major research hospitals such as Roswell Park Comprehensive Cancer Center are robust. There are only 131 universities in the nation who are doing research at this level. You arrive with extensive knowledge and we help you apply it in the field. We provide over 1,200 hours of supervised practice experiences, and we have 2 concentration options, either culinary medicine or community wellness. The graduate degree coursework is in clinical nutrition and includes nutrient metabolism and health, vitamins and minerals, pathophysiology of nutrition-related diseases, epidemiology, statistics, nutrition assessment, and nutrition intervention. And then there are 2 tracks to completing the MS degree. You can do a thesis based on the research process or a comprehensive exam based on clinical nutrition application questions. New interns arrive to the university in August for orientation and team building 1 week before the fall semester starts. The first semester, called Fall 1, is graduate coursework. Winter 1 is the first 3 weeks of January and includes a research course and a nutrition tools course where interns prepare and practice skills such as the nutrition-focused physical exam, motivational interviewing, and EMR documentation. In the spring, supervised practice rotations begin at 24 to 32 hours per week. The clinical nutrition semester lasts for 12 weeks and includes acute care, long-term care, clinical nutrition management, critical, and an endocrinology rotation in renal or diabetes. The facilities we're affiliated with range from large medical centers such as the VA and a county hospital to smaller community hospitals and facilities. The food service semester lasts about 10 weeks and includes experiences in institutional food service such as schools and clinical facilities, as well as community food service such as congregate dining, Meals on Wheels, hunger and food insecurity services, and nutrition, education, and demonstration programs. At the end of the spring semester is the comprehensive exam during exam week, which is one of your 2 options to complete the didactic master's degree. In summer, you spend 10 weeks in your concentration and in research. Nutrition and community wellness is in a community nutrition site and includes the development of a community nutrition program from start to finish. And in the culinary medicine concentration, interns and other health professionals review clinical case studies based on conditions and then apply nutrition science and culinary techniques to recipes that would improve the nutrition concerns of that condition. We cook them together. Interns working alongside medical students and others to understand the transformative power of food and patient behavior. In Fall 2 is primarily supervised practice, 24 to 32 hours per week. And at the end of the fall, if you've chosen the thesis track, you'll have a defense. And our last 3 weeks together in Winter 2 is our concentration capstone project, where we develop and deliver your full program as a result of that summer study. We'll also do professional development, experiences, and guest speakers. The program offers 2 specialty rotations that are 1 to 2 weeks each and include either bariatric counseling in outpatient settings, trauma or burn centers, health promotion and wellness education, or a study in eating disorders. So I hope you can see why we definitely don't recommend working during the internship portion of the program, which lasts about 1 year, January to January. If you do choose to work, we strongly suggest keeping the total weekly hours to less than 10 because supervised practice can't be worked around your schedule and sometimes occurs in off hours because that's when dietitians are working. This is an overall example of the courses you'll see each semester. Fall 1, Statistics, Nutrient Metabolism, Nutrition Assessment, and a Public Health course. In Winter, a Research course and a Nutrition Tools course. In Spring, Micronutrients, Pathophysiology, a Research or Elective credit, and Clinical Practice. Summer continues clinical practice and you'll take a course called Nutrition Interventions. Fall 2 continues supervised practice and you take a course in Nutrition Seminar. And Winter 2 is your final clinical practice semester. We have sites ranging in many practice areas. We have core acute care hospital placements, We have diverse long-term care facilities. Our hospitals often come with a focus in critical care. We have management rotations, learning management skills in clinical and food service. We have rotations in renal and dialysis clinics. We have specialty sites like entrepreneurial dietetics and telehealth. We have institutional food service where you learn scaling, producing, keeping food safe, and serving to a target population. We have community food service where you may be managing hunger relief efforts. We have community wellness. Our research is primarily here at UB. And then we have some optional leadership and above and beyond experiences. Lighthouse is our free student-run medical clinic, and our nutrition interns rotate through weekly on Wednesdays when identifying a high nutrition risk or concern, or someone just wants to talk to nutrition. We're there and support our interprofessional colleagues. And then we can rotate through the field house, which is our athletic training facility where interns are stocking and preparing a fueling station that focuses on pre and post workout and competition athletic nutrition. And then we offer leadership opportunities. And so these are opportunities to develop and deliver a target health fair with a team of other interns specialized. So not everyone will be participating on that team. It's a way to really diversify your experiences here and get to know others together with a goal in mind. This map represents just a handful of our primary supervised practice acute care sites. So as you can see, a car is absolutely required for rotations, as some sites may be up to 60 miles away one way. We do try to work with you for regional placements, but we can't make any guarantees. For those applying who live in Rochester, New York, welcome. We have 3 to 5 seats available each year. It's our preference and for the intern's best experience that you choose the Strong Memorial Hospital Comprehensive Supervised Practice track. This experience encompasses all of your clinical and food service management training across both the spring and the fall semesters. Due to the long time frame, though, and need for the staff to support the experience, the Strong Memorial Hospital track charges an additional $2,250 for that experience. However, it's strongly recommended this track if you choose to commute from Rochester. But also, speaking of commuting, be prepared for the toll that commuting takes on students. Supervised practice is often shortened due to the simultaneous master's coursework, seminar, and other obligations in Buffalo. If there's winter weather, as there will be any time from November to April, interns are still expected to leave with adequate time, and it's about a 1-hour commute. With a total of 21,000 students and 300 degree programs across all 3 campuses, UB really does provide an interdisciplinary educational experience with opportunities to engage in inquiry, discovery, experiential learning, leadership, and global citizenry. We offer a robust university feel, but in a really friendly, affordable, and up-and-coming northeastern U.S. city. Our North Campus is located in Amherst, New York, and provides foundation undergraduate training. Our medical campus is new and located in downtown Buffalo, a perfect example of downtown revitalization. Our South Campus is between those two and is a hub for professional and graduate programs, and that's where we are. This is a picture of our South Campus Hayes Hall. Founded in 1846 as a medical school, UB continues its legacy of high-performing graduate health professional programs. UB is organized into 13 academic schools and colleges. On South Campus, our campus, we have the School of Architecture, Dental, Management, Nursing, Pharmacy, and us, the School of Public Health. And on North Campus, out in Amherst, New York, the Graduate School of Education, School of Engineering, School of Law and Social Work, and then downtown, the School of Medical and Biomedical Sciences. And the most exciting thing, this brand new medical school, every fall and spring, over 900 students from numerous health disciplines engage in interprofessional education forums that focus the strengths of medicine, pharmacy, nutrition, nursing, rehab science, dental medicine, public health, law, and business all together to focus on cases that affect our practice. And in our spring forum, we focus on the way diabetes is managed from all professions as we practice working together as a team. With these planned experiences, UB also offers a micro-credential in interprofessional education, communication, and collaboration, which demonstrates the interdisciplinary experiences that have represented your collaborative and communication skills developed while completing your degree. Completely free, we've built it right into the program. You just have to show up and be your bright dietitian selves. Like I've mentioned, UB is a level 1 research university, and out of the 1,400 higher ed institutions that have that, or that are out there, only 131 have that designation. And our program is only one of 2 schools offering a graduate degree plus internship training. And if you're coming here for sports nutrition, we've got it going on. We are the UB Bulls, and many of our teams compete at the Division I level, including basketball, football, track and field, wrestling, soccer, softball, swimming and diving, and volleyball. Tickets are free for students, and the games are always a lot of fun. Interns begin their food service experience at the fueling station, like I mentioned, in the field house, managing safety, sanitation, and the delivery of food. DICAS application opens December 2nd, closes February 15th. Our admissions favor students with a strong science GPA, and we equally weight references, personal statement, and interview. It's strongly preferred that you complete the DICAS and UB graduate school application at the same time. You don't need to submit a payment with the UB application until after you match, though. We prefer the graduate application completed by June 1st. Interviews are conducted by a teleconference with a small panel of faculty and preceptors. And the cost to attend the UB MSDI is reflected by credit hour, and the most up-to-date information can be found on the university's website. And for those applying from out of state, after 1 year, you are eligible to apply for New York State residency, which would impact your financial. Take some time to write your personal statement and start early in the application process. This is your opportunity to use a story to tell us who you are and what your passion is. Weave in your background information and what personal attributes you will be bringing to our internship program. Let us know why you want us. Take some time browsing our website. Take a look at our faculty. We want to know what you want from us, but also why you want to come to Buffalo. Before hitting that submit button, let someone else read it and give you some honest feedback. They may also catch some grammar and spelling errors you missed, since sometimes you can find yourself swimming in your own words. But review, review, review. We also recommend thoroughly checking out the Ascend website and instructions for the internship match process. If you have any questions, please reach out to me. My contact information is right on the UBDI website. My phone number is 716-829-5653. Thanks again.